Thank you for the wonderful words. Ladies and gentlemen, it's indeed an honor for me to be here this evening and to have the opportunity to officially launch the new cardiac and accident emergency unit at MIOT Pacific Hospitals, which we have already done and which you've already seen. So moving on with the formalities, I'd just like to say that I bring our government's best wishes and congratulations to MIOT International and MIOT Pacific. The shareholders, congratulations. A dream and a vision well achieved for the Fijian people. Honorable AG also sends his warmest congratulations and apologizes for his non-attendance at the launch, but I'm sure he'll be here very shortly to join us. I'd also like to extend another warm welcome to our guests who have traveled all the way from India and abroad to be here with this lovely evening. Prithvi, Dr. Prithvi, your friends and family. Avi, I see your wife is here as well. So welcome, and welcome to our local members as well. Ladies and gentlemen, I've just completed the tour of the new cardiac and accident emergency care unit half an hour ago, which you all witnessed. And I'm sure we are marveled and impressed on what Fiji has achieved in terms of state-of-art, modern-day cardiac and emergency care unit through the vision of MIOT International and MIOT Pacific. When I joined the ministry just over a year ago, Pramesh, you took me to the basement area and took a tour, forcefully made me took a tour of that barren basement that you had, and I was wondering, what is this guy trying to tell me? What's going to happen in the next year or so? And then halfway through that, Avi, you took me to the tour of that basement when the equipments were just brought in. And today, Dr. Prithvi, you took me on a completed facility on a tour, so I thank you for that. And so for me, tonight's launch marks an important milestone for the development of modern healthcare in Fiji, and thank you for that. And I'm sure it has been a long journey, frustrating for you as well, when we did not meet your expectation as a ministry. Avi, the discussions we had, I do record your frustrations about why things were going very slow. And I can assure you that we are changing that. We are no longer into the Fijian mode of doing things, but we are trying to change for the better. And of course, the opening of this unit, ladies and gentlemen, represents a major enhancement to the range, sophistication, and quality of services that are now available for our Fijian people at MIOT Pacific here in Suva. Since entering our local market here in Fiji less than a year ago, MIOT has made significant investments and brought about remarkable changes at what is now undoubtedly our country's leading private healthcare facility, and for the Pacific as well. This is not only a clear demonstration of MIOT's commitment to help our Fijian people have access to state-of-the-art hospital care, but also shows that leading international businesses have confidence in Fiji as offering a safe and secure environment for their investments. Before I forget, I forgot something. Before I move on, I forgot something. On a lighter note, when I woke up this morning, I had a lot of calls coming to me. And for those of you who follow social media very clearly, you know what I'm talking about. So, these people are calling me and asking me things I don't want to reveal here. But I did not pay much attention to that because I knew if I had a heart attack getting that news, MIOT had my heart covered. So thank you, MIOT, for that. And I'm sure with the new services that MIOT has launched today, we really know that our heart is now well looked after by the doctors here. Thank you, Prithvi. So ladies and gentlemen, going back to investments, of course the investments made in the private sector by MIOT are supported by a number of initiatives, including tax concessions that the Fijian government offers to encourage international participation in our growing economy. Recently we made changes to some legislations pertinent to private hospitals operations to make operations much easier for you and more friendly. Ladies and gentlemen, with the positive investment environment created by our government, it is very encouraging to see local corporates such as BSP Life working with returning Fijians. And if I make mention of Avi again, Avi, I've been told of your international relationships and investment expertise and how it has brought about a world-class partner, Dr. Prithvi and MIOT International to Fiji. It is our wish to see more of our local Fijians return from foreign shores to make a difference in this beloved nation. Thank you for that. Our government recognizes the value of a mixed economy in Fiji's health system and public and private sector services working side by side. In addition to support for investors, we have also introduced a number of legislative changes, as I mentioned, to cater for suitably qualified health professionals to bring their skills and practice in Fiji. As a government, we will always retain our commitment to offer all Fijians access to healthcare they need at little or no direct cost. Nevertheless, we also acknowledge that there are people who wish to have access and services from private institutions. These people may choose to use their own funds or may rely on private health insurance to purchase services from private providers such as MIOT. We respect the choice and believe that it brings a welcome diversity into our health sector. I'm also informed over the past years, MIOT has invested more than 18 million Fijian dollars in its hospital here in Suva. This investment has been used to extend the building, as you've been told, and of course to purchase a number of new items of high-tech equipment which were not previously available here in Fiji. Thanks again to MIOT, we now have access to two particularly remarkable machines which will now be both used for diagnosis and treatment of complex conditions. As mentioned by Dr. Prithvi, the Revolution 4D CT scanner can provide multiple 3D images over time, which is the fourth dimension in case you're wondering, and so give doctors access to moving images of organs, blood vessels, soft tissues, and muscles. The cath lab will enable specialists to identify and remove blockages in blood vessels, including those in the heart, without the need for surgery and with very limited exposure to X-ray radiation. And of course, you've heard that MIOT will be bringing expert specialists from India to work in Suva, and they'll be working on a full-time basis and provide round-the-clock access to services at the hospital. I'm particularly pleased to note, however, that each overseas specialist will work closely with our Fijian counterpart. That means we will be able to continue building the skills of our own workforce, and in time, MIOT will be operating on a by-Fijian for Fijian basis. And I think that's the way forward for us here in Fiji. Ladies and gentlemen, it is also important that we acknowledge the skills and expertise that we already have available locally. Our own doctors, nurses, and allied health professionals are trained to high standards. To cite just one example, I was informed earlier this week that a visiting team from CWM Hospital recently completed the first ever brain surgery operation at Lambasa Hospital, a successful brain surgery, the first for Lambasa. Now that is a great achievement. Thank you. That is really a great achievement for our local doctors. Many a times, I've said this in public, we are criticized. We are criticized for isolated cases. But not many a times are our doctors commended for the work that they do. And I'd like to publicly acknowledge the work that my doctors, nurses, and the allied workers do in providing service for the Fijian people here at this forum. Like I said, this is a very, very great achievement for us and our local doctors, and very positive to see MIOT recognizing the skills of our own workforce and committing to work in partnership with our local health professionals. I'm also greatly encouraged to learn that MIOT is taking active steps to ensure that the cost of using the services is not too high. Affordable, accessible healthcare to the Fijians. It is also pleasing to see advanced medical equipment being available here in Fiji. Ladies and gentlemen, the power of today's medical technologies is truly amazing. It means that accurate diagnosis can be made more quickly and cost-effectively. It also means that treatment which once required complex and risky surgical procedures can now be carried out more quickly, as well as being safer and generally less expensive. Or done locally without people having to travel overseas. Nevertheless, it is also important that we do not allow ourselves to be carried away and assume that sophisticated technology is the answer to all our problems. Sophisticated technology may not be a solution and cure all the ills that we have. We need to have balanced investments in high tech with a constant focus on prevention. That's also very important. Fiji, in relation to many other Pacific countries, is facing a growing burden of NCDs, diseases such as diabetes, heart disease, and cancer. And we all know that lifestyle factors and developments such as growing rate of obesity in our population are major factors that underline the growth of NCDs. That means, what it simply means is every one of us needs to look carefully at our own lifestyles, what we eat and drink, and how often we exercise, and of course consider the risks that our day-to-day decisions pose for our own and family's health and well-being. I know this is a cocktail. I don't want to deter people from drinking. Please mindful of what you drink, how much you drink, and what you eat. If you go overboard, I'm sure a walk along the seawall will do us good tomorrow. Coming back, I know nobody wants somebody to preach about eating healthy during a cocktail function, but that's my responsibility. My apologies if I've offended anybody, please. Coming back, the CT scanner that I've been told MIOT has, MIOT CT scanner can detect cancers, but stopping smoking or not even starting to smoke can, of course, protect against lung cancer, which continues to claim the lives of too many Fijians. The cath lab, the new cath lab, will enable doctors to diagnose and treat strokes and heart attack. But regular exercise, quitting smoking if you smoke, or not wanting to smoke, and eating healthy can greatly reduce the risk of them occurring in the first place. I'm not trying to stop people from accessing your service, Dr. Prithvi, but again, it's my duty to tell people this. Of course, another important, fascinating thing that I learned from the MIOT team, that the advanced machines can handle patients weighing up to 250 kg. Here, I'm not sure whether I should be happy to know that, or to know it, or be possibly worried that our growing obesity epidemic means it might be necessary. So these are things we need to look at, okay? Is it signifying that Fijians are obese? You have a 250 kg, I mean, that's for you to answer. I'm not going to answer that. So, ladies and gentlemen, moving on, we've also noted that MIOT is committed to building an effective partnership between Indian doctors and local specialists. And of course, we all need to recognize that good healthcare, and in particular the battle against NCDs, should itself be based on another partnership, a partnership between each of one of us working to lead healthy lifestyles and our health services that are there to help us if we are not unwell. And finally, ladies and gentlemen, I know you want to go back to your drinks and your whatever arrangements have been made, but what I'd like to do is, I'd like to all of us to put our hands together and say big congratulations to MIOT, the directors, BSP, all the stakeholders. All the stakeholders for giving us this state-of-art, modern-day healthcare. With these words, I once again wish you all the best. Thank you very much.